And the same goes for PPE. I know this is even harder to believe than the testing stuff, but this was today. This is not some historical artifact from the bad old days. This was today.
This document confirms what our committee has been hearing for weeks, that we face serious shortages in personal protective equipment, including masks and gowns. For example, page 4 shows demand for N95 masks dwarfed supply in March, April, and May. It also shows that we will need more than 160 million N95 masks in July alone, but that imports and domestic production together will only supply about 130 million masks. That leaves a projected shortfall of about 30 million masks. Admiral, how is it possible that more than 5 months into this crisis, our country is still facing a possible shortage of 30 million N95 masks this month?
This month. Yeah, how is that possible? That more than 5 months into this crisis, our country is still facing the possible shortage of 30 million N95 masks this month. How is that possible? But we are more than 5 months into this crisis. You know, I mean, for shorthand, it's easy to remember. This thing is called COVID-19 because it was discovered at the end of the year 2019. We are now officially tonight halfway through 2020, and we still haven't sorted out PPE. Not even for health workers. NBC News obtained a document today showing that the major medical supply companies in the United States have just warned Congress that there is not enough PPE. The supply lines have not been shored up that would allow us to make enough quickly enough, and the shortages are back and they are real. Quote, the Health Industry Distributors Association tells committee staff it has been imploring the Trump administration to create a national supply chain for months. The companies told committee staff that obtaining personal protective equipment for U.S. medical personnel and patients under current conditions is, quote, not sustainable. This is the medical supply industry itself sounding the alarm in July. And again, this sounds familiar because it sounds like a rerun of the PPE headlines that we saw months ago in March. But this is now, as we head into the back half of 2020, because this stuff didn't get fixed. In the time that we had, in the time we thought we'd bought ourselves with all the sacrifices that were made by the American people, right after the huge, big first spike that was centered on New York and the tri-state area, it turns out we didn't shore ourselves up as a country in terms of testing, and we didn't shore ourselves up as a country in terms of PPE. And in the meantime, all the states sort of randomly opened up without guidance and without regard for whether they had their own outbreaks under observation and under control. And so now we are into our second peak, which is already much higher than the first, and it's all over the country. And now what do? I mean, because we're living this again. I mean, we lived in April through the heartbreak, right, of seeing hospitals in New York pushed to the breaking point. Just the moral disaster there. The American catastrophe there. We lived through that in April with New York hospitals. Well, today, this is Texas. This is the front page of the Houston Chronicle right now. Stay at home this 4th of July weekend. It is the safest thing to do. And that's the front page wraparound front page of the Houston Chronicle right now, because this is the news in Houston right now, right? This is the headline inside the paper. Texas Medical Center hospitals go into phase 2 surge plans as ICU capacity exceeds 100%. Texas Medical Center, which boasts 1,330 ICU beds under base operations, had 1,350 such patients in-house on Wednesday. 1,350 patients in ICUs. Roberta Schwartz, president of Houston Methodist Hospital, says, quote, it's actually possible that we could become the next New York City. I can't believe we're now staring down the barrel of that gun.